Well, look, we still have a high level of infection in this country. We've reached a plateau, but we haven't seen the kind of declines that we were expecting to see at this point. And as we start to reopen the country, cases are likely to go up, not down. We're likely to see those case counts start to increase. The mitigation steps that we took were an attempt to try to prevent the healthcare system from becoming overwhelmed, and they worked to do that. The hospitals never really became overrun, but they were a bridge. They weren't a solution. They're not going to end transmission of this virus, but we did think that we'd be at lower levels at this point when we started to contemplate reopening aspects of the economy. And so as we go through May, we're likely to see the case count start to creep back up again.
Former FDA Commissioner Scott Gottlieb speaking this morning. Joining us now, Director of the Harvard Global Health Institute, Dr. Ashish Jha. He is practicing physician and also professor of medicine at Harvard Medical School. Also with us, Director of the Center for Infectious Disease Research and Policy and a professor in the medical school at the University of Minnesota, Dr. Michael Osterholm. He is the author of the book entitled Deadliest Enemy, Our War Against Killer Germs. I'd like to ask you both if you were surprised by these new projections, for example, from 62K last month to 135,000 dead by August 4th, this by the Institute for Health Metrics and Evaluation. Dr. Osterholm, I'll start with you. Were you surprised in hearing about these new projections?
Well, I can't say I'm surprised. I don't put a lot of stock in those projections because I don't believe that the model really reflects the kind of information that we need to get or that they're using to get. But I think that the general thrust of what they said is correct. We're going to continue to see transmission for some time like this, and it's going to go on for many, many months after this.
Dr. Ashish Jha?
Yeah, I'm very much with Mike on this. The IHME model that you just talked about that the White House has been using has really consistently, I think, underestimated what's going to happen. And so, again, I was pleased to see them updating it. I think they're still underestimating. There's somehow this sense that over the summer into the fall, through the summer, it's just going to disappear. The disease is not going to disappear over the summer. So we're in for, I think, a bumpy ride. And unfortunately, a lot of people getting sick and dying over the upcoming weeks and months.
Dr. Osterholm, last time you were on the show, you talked about us being in the second inning of a 9-inning game. Are we still in the second inning, number one? And number two, when do you think businesses can truly safely reopen, by the way, only at half level with social distancing in place?
Well, first of all, we have to understand, again, that typically a pandemic like this, a virus, is transmitted by the respiratory route, which influenza is the one that we most know about. But this one is acting like an influenza virus, lasts for many months. The only thing that's going to stop this is either a vaccine that is able to then bring us immunity, or the fact that it marches through the population until it gets to 60 or 70%, and only then, when that many people are infected, does it start to slow down. There's nothing else that's going to change this. Now, we can alter potentially how to get to 60 or 70% with our distancing and what we do in the everyday life. But even that's not going to stop this transmission. So when you ask me when can businesses open safely, well, there is no safety right now. There's just a relative degree of what's happening. And I think what we're going to be into is a situation of constantly monitoring week by week to know when do we hit the accelerator to try to slow things down by locking down more, and when do we let it up and say, okay, go back at it. But right now, there is not going to be one day that we're going to be able to turn the switch on and say it's okay.
Willie.
Dr. Jha, it's Willie Geist. Good to see you this morning. On that point about opening up, you've said consistently since the White House put out its guidelines that they are directionally right. In other words, the idea is good, but some of the specifics you quibble with. I was talking a couple of days ago to Dr. Paul Offit, a guy who develops vaccines for a living, who developed the rotavirus vaccine, and he says by opening up even a little bit, we're kind of embarking on a grand national experiment, as if to say we're going to push people back in small doses a little bit and cross our fingers, basically. So what do you make of this sort of phased reopening of the economy and this, it seems, new optimism that people can go outside and go about their lives?
Yeah, so Willie, I certainly am sympathetic to the idea that people do want to go back out into the community and start engaging in economic activity. I think we're all feeling a little fed up being inside. But the question isn't do we want to go back? The question is it even remotely safe to do so? And you know what would have helped a lot in terms of getting us ready to go back is if we had a great testing and tracing and isolation program. But we don't. We basically wasted the last month quibbling about whether we need testing or not when every expert believed it. So even now, if we can make testing a massive priority, it'll make it safer for us to go back and engage in economic activity and kind of start getting our lives back. This is a grand experiment. And unfortunately, the cost of getting the experiment wrong is that people are going to lose lives and we're going to have to shut our economy down again. So that's what I want to try to avoid.
So Dr. Osterholm, as you game this out a little bit, as we do, the governors let people go out and to get some takeout or go get a haircut or do the things that they've done, go to beaches and go to parks. What does that grand national experiment look like to you as we go through the summer and into the fall?
Well, I think, first of all, we have to have a lot more humility as humans with regard to this virus. Just think about 1918. New York and Chicago got hit very hard with that influenza virus in the spring wave. Minneapolis, Detroit, Boston, Baltimore, Philadelphia had virtually no activity. And then all of it disappeared. New York and Chicago didn't have any cases for almost 4 months. And then it came back with a vengeance. Everybody got hit. We may be in the same situation, even if we see improvement. Which I hope some of it is due to what we're doing, and I believe it is, but also nature itself make this quiet. But I'm promising you that we are going to see a major tsunami of activity somewhere down the road. And so what we're really doing is we're trying to get ourselves from stage to stage to stage. And I worry that we somehow think if we just get over this hump, we're there. And again, I got to remind people, we have maybe infected 5 to 15% of the people. We now have a disease that is the #1 cause of death in this country with just that number. Wait till we get to 60 or 70%. Do you realize what we have to go through yet? That's what we have to prepare Americans for. That's what we have to prepare our economy for. That's what we have to prepare our leadership for. And we're not doing any of that right now in any meaningful way.
So I guess, I know that our viewers desperately want the answer to this question, and everyone is trying to answer it as much as possible. But if testing is one of the key ways to get safely back, testing or a vaccine, Dr. Jha, how long is it going? Other countries have this. They've figured it out. How long will it take for the United States to have testing in place? Or will we ever get it?
Yeah, so we're obviously making bits of progress, sort of week by week, and a lot of it is because states have come to realize that the federal government's not going to help, and so they're sorting this out on their own. Let me be very clear that 50 states all competing with each other for a testing program and strategy is not the optimal way to fight this pandemic. But we are, I think, going to muddle our way through. We're going to make progress. I'm actually hopeful that by the fall, a lot of states will make a lot of progress. But, none of this is necessary. We could do this so much smarter and cheaper if we just made it a national priority.
So that's the Defense Production Act. Dr. Osterholm, do you agree with that? And does August look likely in this bit-by-bit piecemeal way we're doing it?
Well, I wrote an op-ed piece in the New York Times almost 7 weeks ago saying that we were going to have a major shortage of reagents and the swabs that we needed for testing because there was no coordinated federal approach. Companies by themselves are not leading us out of this because they don't want to invest millions and millions in making new reagent manufacturing capacity only to have it not being used 18 months from now. This is where we needed a Marshall Plan. This is where we needed the key federal leadership. And just as Dr. Jha said, if we had had that coordination even 6 to 7 weeks ago, we'd be in a different place. I still don't see it today. So I hope we're going to have reagents. I hope we're going to have the kinds of sampling tools that we need. But as I've said on this program before, Mika, hope is not a strategy, and we're running out of time to get these kinds of things. So we clearly need a major Marshall Plan initiative to bring the public and private sectors together, to get the reagents, to get the test kits. Then the states can test, and we need to do that desperately, but it won't happen till then.
Come on. All right, Doctors Ashish Jha and Michael Osterholm, thank you both very much for being on the show. We hope to see you soon. And that does it for us this morning. Stephanie Ruhle picks up the coverage right now.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.